still do a lot of robotic surgery, a lot of vaginal reconstructions and all those things. I have an integrative medicine fellowship. You guys know what integrative medicine is? There's actually going to be a medical school here in this town that's going to be an integrative medical school. And it's actually the future of medicine. Right now, our medical or medicine in the United States is reactive. So if something's wrong, all we're doing is giving you medication to get rid of the symptoms and hopefully things get better. That's what we become. We took that plunge a long time ago and we absolutely turned our heads on prevention. Integrative medicine talks about the ability of taking Western medication, Eastern medication, pulling out the things that work the best to reach an individual. So now we're really understanding what it means to meditate, what it means to eat properly, what it means to sleep. So the fact that there's a medical school that's opening up here in this town just tells you that that's the future. I think we've got to move away from the idea that a pill fixes everything, and that we have to empower our patients to really do something about their own health by educating them properly and not just giving them a pill. So that's what integrative medicine is. Prior to going to medical school, I was an occupational therapist. And occupational therapy was probably what kind of kept me very open-minded when I went to medical school, because occupational therapy was really holistic. It thought about, man through the use of his hand energizes mind, body, and spirit. When you go to medical school, they bleach all that out. They're like, oh no, evidence-based, this is what we're going to do, this is your pathway, and everything else. So I practiced that way for about 10 years before I was like, don't like it. And that's who I am today. I invented a cosmetic procedure probably about 8 years ago, and that keeps me traveling all over probably internationally. We've trained over 800 doctors doing those procedures, and I can talk, it's not what we're talking about today, but I can talk about a little bit about it at the end. Any questions so far about who I am? I hate talking about myself. I'm not that special. So I do have 3 clinics. On that one slide before, I have 3 clinics. This clinic here in Arkansas, I have a clinic in Frisco, Texas, and then I have my main clinic where kind of everything started in Ardmore, Oklahoma.
Wow.
So I live in Denton, Texas, and I kind of travel between all those places. I train, like I was saying before, I have teams all over the place, but I also train doctors all over the country, all over the world. I've been to Europe, I've been to Mexico, I've been to Colombia. And it's been a lot of fun. If you would have asked me 20 years ago, Doc, if you would have told me, Doc, you're going to be published 4 times, you're going to be speaking in front of all these doctors, you're going to be traveling, you're going to come up with some kind of procedure, I would have said, it's the pipe dream, there's no way. But God has his way. He closes the doors you don't belong in, and he opens doors that you're afraid to walk through, but you have to take the leap of faith. So somehow along the way I became someone that people listen to. And that's a lot of responsibility. But I take it in a way that I feel like that I'm passionate enough about what I speak about that I have something important to say. It took me a while to get there. When I first started talking in front of people, I was that guy that was questioning, why am I here? Do I really have anything important to say? And it was actually my son who was like, Dad, have you read on imposter syndrome? And I was like, what are you talking about? I mean, I'm already a doctor, so I get to reading imposter syndrome, and everything I read in imposter syndrome was exactly what I was doing. So I was able to, because of my son, and that I listened, I was able to say, you know what? What I have to say is enough based on my experience and based on the number of years that I've studied. So here I am today. If you would have seen me about 10 years doing this, I'd have been sweating, freaking out, not being able to get a word out, but we've come a long way. So, with all that nonsense being said, let's jump right into the technology that we're talking about. What we're going to talk about today is going to be body type, face type, AccuType. Those are all fancy names just to talk about radio frequency assisted liposuction. Okay? So whether it be on the face, whether it be on the body, whether it be smaller areas where we're raising brows or tightening jowls or getting rid of some mental fat, that's all we do. And then at the end, again, if you guys want to talk about really what I love to talk about, which is the vagina. But you might not want to, but if you want to, we can dive into the vagina, because we care for vaginas. So that's what we do. So before we had technology to tighten up, to be able to take up some of the slack that's left over after we do liposuction. The only options we had were either liposuction or tummy tuck. Right? So if a patient came in and she had any laxity at all, we were going straight to the knife. What BodyTite has done is that it's come with a very, very safe, very proficient, very efficient way of going in, heating up the tissue inside the body, making the fat melt, tighten up the connective tissue that pulls that skin back, and also producing more collagen in the skin so that you can get a contraction. So remember, when all we had was liposuction, how much skin contraction did you think you would get from just lipoing fat out from underneath the skin? Did you say 9?
I said 9 as well.
None. Yeah, it is on the side of very minimal, but I thought you said 9, and I was going to say, you've been reading, it's like 7%.
Oh, wow.
Just because of the inflammation that we cause, that part of it causes us to contract 7%, which is not much, because if you have a little bit of laxity and we take out fat, let's say you have 10% of laxity and we take out fat from there, that 10% is going to turn into about 30-40%. So then we suction, or we tighten, let's say 10% for easier math, you still have 20-30% of extra skin. And that's why everyone ended up being a tummy tuck back then. Now with radio frequency, we're able to take care of that cat patient. That patient that has 30% laxity or doesn't want to have a surgery, we're able to go in and we're seeing about a 30% skin contraction for radio frequency assisted liposuction, aka BodyTite. So that's huge. That's huge because now my practice used to be tummy tuck, tummy tuck, tummy tuck, tummy tuck. Every once in a while somebody was a true candidate for lipo. Now it's radio frequency assisted liposuction. Every once in a while we have to do a tummy tuck. So it's the downtime, the results, the complication rates, all those things are minimized by the new technology that we have. So again, FaceTite, BodyTite, FaceTite, AccuTite, they're basically all the same technology, different size instruments to be used in different places. So BodyTite, abdomen, arms, we can do some breasts, some thighs, flanks, back, and all those things. FaceTite is just the lower part of the face. So it's become very popular as well as Morpheus. You've heard a lot of people are on the weight loss medication. The weight loss medication works really well. It's very safe, but because how well it works, the body's losing fat faster than the skin can change. So you end up with some skin laxity. So some of the things that we're doing for that to prevent skin laxity on people that are losing weight is starting off like on a Morpheus, on the same type of radio frequency procedure that helps that skin continue to tighten as weight loss. And you know, a lot of times we're saying, you know, put a little more weight back on, you're looking like a crackhead. You know what I mean? Y'all know what I mean. So it's not a great look. So for that, we call it they call it the ocipic face or the whatever. You've heard it, right? So for that, we have things in place, right? Instead of saying, oh, you know, some people, we'd rather look a little better, not be so healthy. Well, now we can combine it. You can be healthy and look good as well. Okay. So again, BodyTite is bigger instrument for bigger size. FaceTite is for the face. AccuTite is a small little device. With this device, we're doing things like brow lifts, just jowls, cemental. This one here normally doesn't have any liposuction behind it. We're just using the power of the radio frequency to tighten and remodel that fat. We're also using this like above the knees, elbows, a lot of vaginal work. The procedure that I came up with was using AccuTite to basically shrink labias and tighten up the whole entire vulva around the clitoris, just so things look better and function better. Any questions thus far? I'm talking fast, I know.
How many
Are we hungry?
treatments?
Great question. So for the face type, body type, eye type, it's just one treatment.
Wow.
So we do one treatment, and normally you have to have compression, because we do a little liposuction at that work compression for a couple of weeks. There will be swelling that fluctuates for about 6 weeks out, and then we start nearing our final collagen starts to kick in at 3 months. That's when you start seeing the tightening, all the way out to a year from there, you continue to have tightening. But it's just a one-time. It's a good question. Now Morpheus,
Question,
yes ma'am.
could you get more than one done at one time, I'm assuming yes? If you wanted to do like stomach, arm.
Yeah, I see what you're
Yeah,
saying.
right.
That's a great question. So, because all these procedures we're doing in the office, there's a limit.
Really?
Yeah, so you're wide awake talking like we are. 99% of my patients tolerate it that way. The rate limiting amount of places that we can do at one time has to do with how much lidocaine we can give you.
Got it, okay.
So we
Okay,
calculate
okay.
the lidocaine max,
Okay.
and from there we can say, let's say you say, hey doc, I want an abdomen, I want flanks, I want my arms.
Mm-hmm.
So we'll calculate that max, and we'll say, okay, we can probably do your abdomen and flanks one setting, and then your arms the other setting.
Okay,
And
okay.
it's not so much because it can't be done in one setting, it's
Right.
because we have limitations on the
Right.
amount of medications that we can give you.
I didn't
So,
know.
yeah,
But you don't go under.
That's a good question. So Morpheus, I'm gonna talk to you about Morpheus. Morpheus is a complete different approach. Most of the times in the face type and body type, we go in and we heat things up, we suction, and then the last thing we do is take a you guys have had any microneedling before? So Morpheus is microneedling on steroids. So we're taking on the face, on the top one, we're taking a 24 pin microneedle that can go into different depths. At the tip of them, they're coated so it doesn't release any heat on the skin surface. At the tip of it, it ablates, and then that heat comes back to the hand pieces. So those three things. So on the way microneedling works is that mechanical injury causes the body to have an inflammatory response, which brings in the stem cells that create collagen and elastin. It's minimal because the inflammatory response is not as big with just needle. This causes inflammatory response from the microneedling, from the ablative portion of the radio frequency at the tips, and from the bulk radio frequency that comes back to the handpiece. So the results are much bigger. So for this, there's no liposuction. For these cases, normally is 3 treatments, 3 to 5 treatments 1 month apart. Okay? And we love combining this for people that are also losing weight because it keeps us from having that extra sagging skin.
Is there, the redness that comes with the derma and?
Yes.
Oh,
Yeah, absolutely. There's going to be some redness. The amount of energy that we put in changes depending on your skin type, but the downtime is minimal compared to like something like CO2. Right? When we do CO2 on the face, we're burning off that hide, and most people don't go out in public for the first 3 or 4 days because it looks like their face. This is not like that at all. There's just some redness topically that you can put makeup on within 3 or 4 days. Okay. Any questions on that? All right, so we'll go back. What is body type? Body type is our ability of contouring the entire body without taking off extra skin and not having a bunch of skin left over. It's what areas, who's going through this, all these things that we're talking about, what areas can we treat? We can treat abdomen, flanks, arms, inner thighs, outer thighs, upper knees, face, neck, all of those things. How many sessions recommended? Only 1 session. Only 1 session. And again, anytime anyone is doing anything underneath your skin where we're liposuctioning, we're disturbing all of those things that live there. So lymphatics, your vessels, your nerves, all that gets disturbed. The coolest thing about radio frequency is that when I used to just do lipo, the amount of bruising and stuff was extraordinary. When we use body type, it's minimal amount of bruising. And is much faster. So let's look at some before and afters. So again, this is a patient before I had body type that I would say you need tummy tuck. Right? This was what I was talking about. If I suction there and nothing tightens that stomach, she'll have all that skin left over. So you can see where the body is actually tightened back up, things have pulled down, and she doesn't have a ton of extra skin there. Then the arms I like a lot because the scar of the arm surgery is horrible. No one likes to have that big little scar down the arms. And most arms do really well. Of course, not everyone is a candidate. You still have people that need to have the surgeries and the tummy tucks and all that good stuff. These are all a couple months apart. This is also a patient that I would have absolutely done a tummy tuck on. We liposuctioned her, and this picture was actually a month out. So all the change is still not changed. She's still swollen in this picture. Wow. Again, it's another patient that I would have probably done a tummy tuck on. And 3 months out, things have tightened. Even her skin quality looks much better.
Mm-hmm.
And you can do that in 15 minutes.
No.
Okay.
Who said 15
Did
minutes?
I not read that? It was on the first slide.
On the first slide?
Yes.
Let's go back to that.
Back
Right
right
there.
there, yeah, right
Each
there.
zone.
So 15 for belly and 15 for back.
That might be with the Morpheus, but not with the body type.
Got it.
Okay.
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 Disregard that. I'm glad you put that up. Brought that up. I was like, 15 minutes? Who said 15 minutes? Yeah, no, not 15 minutes. Well, let me take that back. I see what this slide is trying to say. So in area, like if I'm going to do a liposuction of your anterior belly, I'll have 2 little small incisions here, one in the belly button. And if you break up this into 4 quadrants, it'll take me about 15 minutes to heat up each one of those quadrants.
Oh, okay.
Misleading.
I'm like, wow.
Misleading. So it'll take about 15 minutes to heat up with the body type, but then I have to go in there and suction and all that stuff. So no, if I'm doing an abdomen, yeah. I'm glad you brought that up. Okay, so back as well. These are areas that are hard to lose regardless if you're in shape or not. Once you gain weight in certain areas, like I got these, my wife says she likes them, but I don't like them. But the little love handles back here, you can't get rid of them, and it's this procedure back here works really well because the skin is tethered here and it tightens up really well. And then one last thing that we can really do, patients that don't want to have the big breast surgeries and all that stuff, we can make a small little entry point right above the nipple, and the entry point below, heat all that stuff up, tighten it up, and we can get about a 4 centimeter lift on breast. Again, not everyone is candidate for that. Depends on breast size, how much descent is had, and all those things. Okay. Any questions on those before and afters? Nada.
Well, okay, you said not everyone is a candidate. Does being obese matter, right? Because a lot of the women here, they look
It does.
a little bit on the
Well,
smaller.
when it comes to most of the stuff,
Mm-hmm.
being obese matters because we're doing an elective surgery
Right.
in a procedure room in an office,
Mm-hmm.
right? So they're standard.
Right.
So the standard is that if we're going to do an elective surgery in a procedure room, that our BMI needs to be at least below 35.
Okay.
Right?
Okay.
Because above 35 increases risk of clotting, of infection, and all those things. And that's why we love the idea of losing weight first and then considering these things.
Okay.
So, and then when it comes to breast lift, the heavier the breast, the harder we're going to lift it just by tightening up the
Yes.
skin.
Yes. For sure.
So face tight. Now this procedure will take me about 45 minutes to finish. Okay, about 15 minutes to heat up the area. So face tight, I love face tights because the improvement of the results are just drastic. You can see them nearing the same advanced, but we do facelifts, but nowhere near the downtime or the top of the complications that you can get from facelift. We've done a ton of these. Patients are, for the most part, very ecstatic with the results. We do have to wear a compression for about 3 to 5 days for the same reasons that we talked about the face. I mean, the body. So, again, nasal with the AccuTite, we can do nasal labial folds and tighten them, brow lifts. Who does Botox? You know, whenever you get the little Botox here and it makes you lift your brow a little bit like this and makes you look a little younger or more interesting. That's what the AccuTite does, but it should last much longer than what Botox. So typically, again, one treatment. You start seeing results within 6 weeks. Most results start coming in about 3 months, and they continue to change all the way up to a month.
How long do the results last?
You know what? I was about to pose that question so that you guys, because I was like, normally people ask, and bam, right on it. So when we think about collagen production, the studies that we have on collagen production and then degradation after that, mostly is on the face. And then those studies show 2 to 10 years of lasting. Why is that a range so far? Right? It's because the people that last less, something's different happening. They're fluctuating in weight, right? They're not caring for themselves. They're not putting on their sunscreens. They're not sleeping properly. All those things, you know. They're living in the unhealthy side of things more than the healthy side of things. So 2 years. If you're OCD about your health and you're trying your very best at everything else, more than 10 years. More like 10 years. Most people, somewhere in the middle. When I think about healthy living and things, especially as a doctor, a lot of times there was a time in my life that I thought it was 100% doable to be perfectly healthy. Right? That's when I was a little younger, less mature, didn't know what life really was about, didn't know the heaviness of the world at that time. But now when I think about healthiness, I explain to my patients more that healthy living is more like an undulation, right? If you have a graph of health versus time, some people live perfectly unhealthy. There's people that have given up on the idea of being healthy. You see them smoking all day long, drinking, don't care, mad, yelling at people, don't sleep. Those people have completely fallen off the rails. There is absolutely nobody that's perfectly healthy. If you find somebody that's perfectly healthy, let me know, we'll worship them. It's Jesus Christ. It ain't no human. Most of us do this. Most of us undulate, and that is normal. As a physician, what I ask is like, listen, get to know your rhythm. Get to know your rhythm. Understand where you're living the most healthy. And understand how you got there. So that when you're here, it's easier to make your way back. And as a wellness clinic, we have hacks to help you. Like you can say, look, man, I'm in an unhealthy time, doc. I need help. So we have things like IVs and things like that. That's the best way of thinking about life. We all know, I mean, we all dive into diets that are strict diets. No one can attain that forever. And it's not even natural. You know what I mean? Count your macros. What fun is that? Right? So honestly, when it comes to your health, you've got to know your own rhythm and understand where you're at. And when you need help, look for help. Anyway, that's from the question of how long it lasts. So face type before and afters. So we make a small little incision here and then an incision in the corner right below the tragus in front of the ears. And we clean all that out in the bottom. And as you can see, I mean, this is normally would have been like a face type before. The response to face type is pretty impressive. And then this is under the eyes. More Morpheus under the eyes, that works really well. Now this, she didn't have the brow lift, but it kind of looked like she did. Another face type, so you can see Oh, there's no definition here. She has a complete jawline. Takes about 10 years off of their age.
Okay.
And again, that's underneath the eyes and a little bit of the brows there. So you can see her eyes have come up a little bit. This guy, he obviously, he needs it black, but I'm sure he doesn't want to have it. The same thing. Any questions on that face type? Nada.
Well, I don't know. I'm noticing like the laugh lines, if that's what we call it, I don't know.
Yeah.
Interesting.
The marionette lines, you're noticing that there's improvement in them.
Oh, yeah.
Yeah, so
definitely.
what happens is when we heat this up, it tightens this way, right? When we heat it up here, it tightens up this way, and that's what's going on. It's been pretty impressive. Like when when you first start doing anything, you don't really know what all the results are going to look like, and that was the tightening of those are what surprised me the most.
Good.
So again, Accutite is everything I just said, smaller with no liposuction behind it. Body type and face type both have lipo. Accutite does not. But with Accutite, again, you can also treat with that little small one underneath the eyes. I've actually trended to doing more Morpheus alone underneath the eyes than the Accutite. And the reason for that is not because the Accutite doesn't work, but the amount of time of swelling in the eyes drove me insane. So if I tell you I'm gonna do your eyes, they're gonna look good after 6 weeks, but for 6 weeks you're gonna be swollen. Not so cool. So, but the Morpheus gets just as good results. Again, underneath the eyes. And then these are just local little submental areas without any suction. It's a little different procedure. So this little submental areas without any suction on them. I feel like that's a face type.
Yeah, she looks.
Yeah, that looks more like a face type. I think they put this picture in the wrong place.
She looks, I would say
I
she
know
looks
Dr.
really
Romo
good.
does not get this good of results with Accutite. The reason I feel like it's a face type is because of the change here. There's definitely liposuction. Then the eyes again. Okay, so let's go over Morpheus one more time. So the cool thing about Morpheus, I kind of explained to you all the different mechanism of actions, but we can go in and we can stamp at different levels, right? Like we can go 4 millimeters and keep the needles there and remodel that fat right underneath there, which is really cool. We can heat 4 millimeters, 3 millimeters, 2 millimeters, and 1 millimeter, so that whole entire envelope, so that it tightens really well. But then with the body, we can treat even deeper. So with a body like for cellulite on the butt, on the arms, and also to remodel fat, we can go 7 millimeters and all the way burst all the way to 1. So it's a really good. It's the most Morpheus is probably the most popular procedure in the country right now.
Makes sense.
Almost everyone in Hollywood is doing Morpheus, which is actually why it's become so popular, because they're all talking about it on TikTok. But it's a very minimally invasive, minimal downtime way of taking care of your skin and tightening things. And for darker colors like ourselves, it's hard to find things that don't cause us to have hyperpigmentation. Morpheus is one of them.
Okay.
And it's all on technique, right? Or melanocytes live about 1 millimeter in depth. So when we're doing things like this, we don't want to excite them. So we heat below it and stay away from heating right into it. But we still have just as good response.
It is.
How many sessions? So normally once a month for 3 times, but for some folks it could be add a couple more. Just depends. We definitely have to numb. None of this is done without numbing. You wouldn't like me so well if I did it without numbing. Again, so this is the Morpheus on the eyes. As I told you, I like Morpheus on the eyes because the downtime is a whole lot less and the response is pretty good. And then acne, we can treat active acne scars. We can treat we can treat scarring all over the body, reduce scarring, we can reduce stretch marks with it.
What?
Yep. So again, this is just Morpheus. From the back, everywhere you have skin, we can do sagging skin, we can do your Morpheus. Any questions on that?
No.
You guys want to get into vaginas or leave it alone? You know what, I will show you the pictures.
You say why not?
I will show you the pictures, but the idea of your pelvic floor is something that's really missed.
It is.
So let me spend
Okay.
like maybe 5 minutes on it
Yeah.
to just open your minds on what's out there. And this is usually, this presentation I'm gonna do is a little different. It's not normally what I do at lunch. So what we talked about a minute ago is body type. This is called Empower. Okay? So Empower is called Empower because we're empowering women. It's a women's platform. And what we know about women is that 90% of women end up with some type of pelvic floor dysfunction after either vaginal delivery or some type of surgery that they've had that no one has really paid attention to. Pelvic floor dysfunction means leaking, pain with sex, prolapse, things falling out, constipation. All those things are pelvic floor dysfunction. People that have pelvic floor dysfunction, about 50% of them end up with sexual dysfunction. Growing up, talking about sex is something you keep in the bedroom, Dr. Ramirez. What are you talking about? This is not something we go around talking about, but the problem is, if we don't talk about it, is that women that are sexual dysfunction are more likely to have heart disease, obesity, diabetes, depression, anxiety, and all those things. So if we just chalk it up to a grandma telling you, hey, just be happy, you got a kid, why are you crying? Deal with it. When I first started, when I became an OBGYN, there was a couple things that I didn't like about it. One was hormone replacement, because they scared the crap out of all of us about hormone replacement. Now we know a lot more, and it's one of my favorite things to do. Number two was someone coming in and talking to me about sexual dysfunction. I had zero to offer them back then. All I had to tell them was, okay, you have to open up channels of communication between you and your partner, come up with coupons, everything, almost nearing the idea of just fake it, is what we were saying. Right? Nothing to offer. So now with everything we have now, we have a way of preventing, improving, and making it look better without a knife, which is huge.
I saw the pictures and I thought a knife was used.
No knife. No knife. So what happens in a vaginal delivery is that things distend about 200%. Once you have your baby, you're in postpartum, they give you high dose Motrin for pain because they're worried about your breast milk. They're no longer worried about females at that point, they're worried about the baby because they don't want to give them any narcotics because they're being a breast milk and it'll injure the baby. But what they don't say is that high dose Motrin is actually decreasing your ability to heal on something you just tore in all kinds of different places and everything else. So this is standard of care. 6 weeks you go to see your doctor. We look, we say, oh, everything is healed. Do your Kegels at home. Every time you're at the stoplight, every time there's a commercial, that's the instructions. Well, the problem is, how do we treat our athletes when an athlete is injured? So I played soccer in college. When I hurt my knee, one of the first things they did is send me to physical therapy. They made sure that this quad stayed strong before surgery. Then I went and had surgery. Then before I was able to step back out on the soccer field, they made sure that I had full range of motion and full strength in this leg before I was back to doing what I was doing before. Why don't we treat our women that way?
Because doctors are men.
I I don't disagree with that. Most of the research is done by us.
Yeah.
Yeah.
Right.
But we're starting to get to a place that we have absolutely opened our mind and understand the importance of the pelvic floor. So because of that, in our office, we have the Empower. The Empower has an Aviva portion of it that we can go and tighten everything on the outside, make things look better. On top of making things look better on the outside, we also tighten up the clitoral hood, labia minora, and perineal body, which allows them to have more friction during sex on the clitoris, easier orgasms. We have a modality for every tissue in the pelvic floor. We're able to strengthen the muscle. We're able to regenerate that soft cutaneous tissue that's been torn and also atrophied over time. And then we're also able to improve the mucosa, sensation, lubrication, and tightness.
Oh, wow, that's
I
nice.
have a question now.
I figured when I
I
brought up the vagina, I was,
so, you know, okay, so I've read before, right? Most women do not orgasm during penetration. Would this help with that?
It does help. It does improve. It improves the sensation of the vagina. What happens a lot of times with not, there's a couple things that happen with not being able to orgasm with penetration. One is that a lot of women don't have that G spot that's completely sensitive. And then two, things are laxed around the clitoral hood. So if you look at the clitoral hood, you guys know the anatomy.
Yeah.
The clitoral hood attaches to labia minora, attaches to the perineal body. When those things stretch and things lax and that clitoris falls out of that space, when you're having sex, nothing is frictioning that clitoris. You see what I'm
Yes,
saying?
yes, yes.
So what happens with the Aviva is that we tighten, or the femtite is what we call it. We tighten up the mons, which pulls back that clitoris. We tighten up the clitoral hood, the labia minora, the labia majora, the whole complex where things tighten up like this. So when they have intercourse, there's more friction. So it improves that ability of orgasm with just penetration.
That was a possibility. Got it. Okay.
It's possible.
It's possible.
So, we'll go through all that. This is a lot deeper than you guys need to know.
So this is what you created?
Yeah, that's that what you just saw is what I created.
Wow.
Oh man, I got the deep. This is when I'm talking to my doctors. That's all right. Let's look at some before and afters here. So, clitoral hood, labia minora, perineal body, mons, labia majora. Do you guys see how that just all is drooping?
Yeah.
When we do the femtite, see how this pulls back.
Yeah.
The clitoral hood is shrunk and pulled back. Labia minora shrink. This perineal body grows and everything is tight. So that's how those things work. Now, that's just the external part. This is my baby. But the other stuff that's even more important is tightening up that inside, improving the thickness, improving the lubrication sensation, possibly even improving that G spot, is an internal vaginal morpheus. Remember earlier we were talking about morpheus on the face and the body?
Yeah.
Well then we found out is internally that morpheus works even better. So with the internal morpheus we're able to tighten, lubricate sensation. Then
So those are separate treatments?
yes.
Okay.
Yeah, there's some people that will come in and they want it all. They want the whole kit and caboodle. We'll go in, we'll make things look better on the side, tighten things on the inside. And then there's a session for Morpheus, V-tone, and Forma V. Remember I told you there's 3 different tissues in that pelvic floor. We have to treat all of them to improve, prevent, and optimize. And the V-tone improves the muscle. The Forma V improves the connective tissue, and the Morpheus improves that mucosa. So this is an entire pelvic floor modality that I feel like every OBGYN or anyone that takes care of women should have and screen from the top of the mountain. We're able to decrease stress incontinence about 70%.
Wow.
Urge incontinence, which is the worst one, is the one that comes on and you can't make it to the rest of the American spills. We're able to treat that 90% 6 months out.
Wow.
Yep. We're able to improve lubrication. We're able to improve recurrent UTIs, recurrent BV. We're able to improve vaginismus. This is where the vagina tightens up and it just won't release and it causes a lot of pain. So, all right. I have filled you girls full of knowledge.
Wow.
Any questions? All right. Well, it was nice hanging out with y'all for lunch. Please serve yourself. Is there anything you need?